Hi everyone, welcome back. So today's topic is good running technique in order to avoid injury. Now, I've talked a little bit about in other posts and posts that I will be putting up about how obviously you can sort of change your running route and make sure you wear supportive shoes and things like that. But for this video today, I'm really just going to talk about, postural changes to ensure that you have the best posture possible while you're running. And this has really come about because obviously doing the job that I do, I tend to find myself kind of watching people and observing their posture, whether they've got pelvic tilt or whether they've got signs of an injury and things like that. And yesterday morning I was sat in my local park and there were a lot of people running around the park, and I sort of found myself observing the various postures of the people running. Some of them were very good, and some of them were probably an injury waiting to happen. And you could really see the difference in sort of the quality of their running, by their posture. So hopefully some of the information that I'll give today will just sort of help you think, about what you're doing and whether you could make any improvements. So in terms of runners, it's thought that about 65 to 80% of runners acquire some sort of injury. Now, whether this is due to overtraining or unsupported footwear, or maybe their core strength isn't quite as good as it should be, whatever the reason, that's quite a high, quite a high rate. And certainly in practice, I see a lot of runners, with tight IT bands and things like that. So, but also of over 2 million recreational runners just in the UK alone, it's thought that up to 25% of those are actually out of action at any given time due to injury. Now, in terms of running injuries, the common ones that I see in practice, we're talking about things like shin splints, IT band syndrome, runner's knee, Achilles tendinopathy, and also sometimes plantar fasciitis. And I will be, doing other, if I haven't already, I will be doing sort of specific posts on these type of injuries. So in terms of looking at the relationship between, poor posture and running injuries, there was actually some research done by the University of Salford, which basically looked at specific aspects of running technique through infrared gait analysis. And it compared runners with a history of, some kind of injury, one of those ones that we mentioned, the shin splints, the IT band syndrome, Achilles tendinopathy, or runner's knee. And it compared those runners to runners who have never had any history of injury. And what they discovered was that poor posture, really does increase the stress placed, through the body on the joints while running. And they found common biomechanical patterns that were, sort of occurring in the injured runners that basically differentiated them from those that had never had an injury. So these biomechanical patterns, we're looking at things like they had a greater forward lean while running, or they had an outstretched leg and high foot angle on initial contact, with the ground. And some of them had, which was probably the most common pattern that was observed, had what's called a contralateral pelvic tilt, or it's a sort of a side to side pelvic tilt. And it was estimated that for every 1 degree increase in pelvic drop, the risk of injury actually increased by 80%. So, again, that's quite a high figure. So, okay, so I'm just going to show you a couple of diagrams now to show you these biomechanical changes that made some of these runners, more prone to injury. Okay, so in this first diagram, we can see two different runners, and hopefully you will see from this two very different postures. So in runner A here, this is an injured pattern. And so you can see certainly there's a greater forward lean than in the healthy pattern, which is quite upright. In this one, it's leaning forward a lot more. And also there's a higher foot angle, causing a heel strike on the ground, rather than in the healthy pattern where it's more of a mid-foot, planting on the ground. So yeah, in this one, it's really that forward lean and the high foot angle that are making the difference. Now also, if we look at the pelvic tilt, the contralateral pelvic tilt that we were talking about. So if you look in runner A, which again is the injured pattern, and runner B, which is the healthy pattern. So in runner B, you can see that everything around the pelvis and hips falls nicely in line with the legs. It's nice and parallel to the floor. And if you've seen my video on pelvic tilt, you'll hear me talk about the imaginary line across the top of that pelvic bone. And so basically what this diagram is showing you is what's called the Q angle, which is the angle at which, the femur, the thigh bone, sort of comes down from the hip. Now, I've mentioned this in various other videos, certainly I think the pelvic tilt video, and also I did a video on femoroacetabular impingement, which will talk about the Q angle. The Q angle certainly, it will be, a greater angle in women because their hips are naturally wider. But you can see here, this really is quite a wide angle compared to this one. And also you can see that this line across the top is not parallel to the floor as in the healthy pattern. There is a slight tilt, and that tilt will change as she takes each step. So that is the difference in postures. Okay, so it's all very well me sitting here and saying, well, this is what's wrong with people's posture when they run. This is, how injury happens. What actually is good running technique and good posture. So I'm going to talk about that now. So a person's general everyday posture is certainly going to reflect in their running patterns. Probably the easiest way to explain a good running posture is if you imagine that there's a line, an imaginary line dissecting the body from the feet through the ankles, knees, hips, shoulders and ears, sort of as you look at someone side on. There'll be a straight line through those points. And this line, should be maintained when you're running with a slight forwards tilt. Now, obviously in those diagrams that I've just shown you, I've talked about in the injured pattern about there being a forward tilt. Now, when you run, there will naturally be a very slight forwards tilt. The one in the diagram was a much sort of greater angle, than it should be. So if we talk about, sort of each part of the body, and sort of how that can affect your running and what you should be doing, to optimize your, running performance at the end of the day. So first off, I'm going to talk about the feet and ankles. That's where it kind of starts. So if we look at a normal walking pattern, the foot lands with, a heel strike out in front of the body, and that leg is usually pretty straight. But when you're running, the force that passes through the leg, is greatly increased compared to walking. And so it's really important to maintain slightly soft knees, not to have that leg in full extension, so that, the joints can absorb that impact more easily. Also, we talked a little bit in the diagrams about how the foot plants itself on the floor. So as we've said, like in walking, you'd have a heel strike first, but in running, a midfoot landing is actually better in terms of aiding shock absorption and reducing the impact. And also it will help to promote a better body position in general. Midfoot planting is also much easier if you're maintaining just that slight forwards tilt. Many runners, and I saw a few yesterday, certainly overstride, which means that one, they land with a heel strike out too far in front of the body, which is going to mean, that there's a greater impact going through those legs. But also, in doing this, it means it's almost like a brake effect. So if you're landing with your foot too far out in front of you and heel first, what that does is it actually causes the body to slow down, because it's got to lift itself further over the foot. So ideally, you want the foot to be landing pretty much directly under the body, while sort of still pushing forward into the next step at the same time. So next part is the hips. Now, the hips are essential for running propulsion and also for the knee drive. If we look at the posterior chain, there should be good leg extension as the body moves over the foot. Now, if this is restricted, maybe through a hamstring injury, your stride length will be limited. So again, quite often, when you see runners out and it's almost like they're shuffling along, you feel like they're not really taking actual steps. Their feet are just kind of shuffling under them. And that potentially, could be that they've maybe had a hamstring strain, or something like that in the past. Also, if we look at the glutes, quite often injuries happen because people don't engage their glutes when they're running, and so then all the leg muscles are overcompensating and having to work harder. But by engaging the glutes, and also keeping the hips loose, you will actually gain full propulsion with each stride. And again, that impact will be kind of, divided between the muscles rather than, the leg muscles taking all the impact. Okay, so the next area that we're going to talk about is the torso. Now, you hear people all the time, saying to people with bad posture, stand up tall, shoulders back. And actually, this is quite important when you're running. By running tall, keeping those shoulders back, pulling your abdominal muscles in, what that does is it causes the pelvis to just tilt posteriorly a little bit, only a little bit. And so what then happens is that brings the hips up towards the chest, which makes it easier to lift those knees when running. And, again, in order to propel yourself forward well, you want to get, a good lift in the knees rather than just shuffling those feet along underneath you. The shoulders, keeping the shoulders relaxed also will help, with maintaining a good breathing pattern and also just with the general movement. But any movement in the shoulders should only be coming from that propelling movement with the arms and not from the, you shouldn't be moving the shoulders themselves. It should only be coming from the arms. And with regards to the arms, there is a diagonal link, from the shoulder and the arm to the opposite hip. And that should be maintained, while running. By keeping the shoulders relaxed, with just a gentle bend at the elbow, and keeping those arms close into the torso. They shouldn't be sort of out here. You're going to propel yourself a lot better if the arms are kept in close. And the hands, again, you don't want like clenched fists. You want just a good relaxed hand. And again, that's going to help with, propulsion. Also, with regards to arm movement, any arm movement, we've said, keep them close to the body, but also it should only be a forward-backward movement, again, to propel you forwards. Any sideways movement while you're running, it's just counterproductive, because all that's going to do is, one, it's going to affect forward propulsion, but also it actually means that the legs will then start to overcompensate, and do some of the work, with pushing you forwards that actually your arms could be doing. And, you can test this out, try, just try running sort of like 10, 20 meters with your hands down by your sides, and then try it again with a good propelling, and you're going to see straight away the difference. Okay, so then finally the last thing that we should be aware of is in terms of the head. which may sound a little bit silly when you're running, because people always think it's in the legs. But actually, even the head can, really affect your posture. The head should be facing forwards in line with the rest of the body. If it's too far forwards, or if you're facing down, then lifting the knees at the front of that running gait is going to be difficult. Whereas if the head is too far back and you're kind of really, almost too upright, what's then going to happen is that as you bring that leg forward, you're going to strike the ground with your heel, and you're going to end up overstriding, which obviously we've talked about. So what you want to be doing is just reducing any excessive head movement, and this will avoid, the body overcompensating in other areas. So basically stay focused on your route, on where you're going, instead of having a good old nose at everyone else, in the area. Now the other thing just to that is important is obviously breathing, which again sounds really silly because it sounds really basic, but actually a lot of people don't breathe properly when they're running or when they're at the gym or whatever the activity may be. So we've talked about how keeping the shoulders down and relaxed will really assist with a good breathing pattern, and certainly common signs of a poor breathing technique, certainly when running, is when there's tension in the shoulders, face and neck, which I see quite a lot in people out running. Runners should be using their, full lung capacity, breathing in so it reaches right down into the belly. And as I say, just keeping those, shoulders down. You will notice the difference. And obviously, if you're breathing with a good, if you've got a good breathing pattern, that's going to help reduce injury as well, because you're going to be getting a lot more oxygen into the blood and the tissues, which is obviously helps if your oxygen, saturation is good. That also helps afterwards in terms of muscle recovery and things like that. So in terms of practice exercises that you can try, we've already mentioned one in terms of, the arms and just making sure you've got that propelling motion. But also what you can do is just start by running on the spot, and bringing the knees about halfway up to hip height and making sure that you're landing on the midfoot and not with your heel. And when you land, as well as landing on the midfoot, you should be making just short spring-like steps. Should be a very short contact time, on the ground. So practice. Once you're comfortable doing this, you can then increase the knees to hip height, and just practice, just to notice sort of the improvements in the knee drive and how that affects, everything else. Okay, the next thing that you can do to practice good, technique is working on activating those glutes by practicing buttock kicks on the spot. So what you can do is keeping your arms straight down, place the back of each hand on your buttocks, arms straight down, and you're going to flick your feet up, alternating each side. Flick your feet up towards the bottom, and the aim is, if possible, you're going to be touching your hand with the heel of your foot. But you want to do this ensuring that you're maintaining an upright posture and you're not leaning forward. And just, keep practicing that until you're comfortable doing it. And then to progress with this, you can continue this exercise by doing it while moving forwards. So, maybe 20 meters, by practicing the buttock kicks, and then you can jog back using that suggested, movements that we've been talking about. So yeah, that is really sort of some tips on how to improve your running technique. Hopefully it's helped. And when you're doing these exercises, you can always do it in front of a mirror as well, just so you can really see what your posture is doing, because I think a lot of the time, as well, people actually aren't aware of what their own body is doing sometimes. But yeah, hopefully it's helped, and so I will be doing more posts on different injuries and different groups of muscles. There'll actually be one on calf muscles and calf muscle injuries coming up, and obviously that's a really good one for you runners out there also. So yeah, subscribe to my channel, you'll be notified when they come up. Do feel free to comment, or you can message me through my Facebook or Instagram pages, and I will do my best to answer any questions you have. But for now, that is all from me. So I will see you next time. Take care.